Hi, my name's Kailey. I'm going to be taking care of you today.
Okay.
Can you tell me your name?
Gretchen Baxter,
Okay. And your date of birth?
9/10/99.
And that would make you 20?
Mm-hmm.
Okay. And where were you born?
Cincinnati.
Right. And is your biological gender female?
Mm-hmm.
Okay. And what's your gender identity?
Female.
And are you Caucasian, Hispanic, African American?
Caucasian.
Okay. And what's your religion?
Catholic.
And what's your marital status?
Single.
And your occupation?
I'm a dance teacher as well as a student, as well as a gift shop employee.
Okay. And what's your address?
6763 Salem Road, Cincinnati, Ohio, 45230.
And your phone number?
513-638-4804.
And your email address?
GretchBaxter@gmail.com.
And do you have any allergies?
Nope.
All right. And do you have somebody as a point of contact?
Yeah, my mom. Her name's Shelly Baxter.
Okay. And what is her phone number?
513-478-8928.
And do you have another phone number you'd like to write down?
513-478-7056.
And do you give consent to this person receiving information?
Yes.
All right. So what brings you in today?
I'm having extreme pain up my right leg.
Okay.
It's throughout the whole thing. The pain's going up towards my hip.
Okay. Is there any swelling?
Yes.
And when did this begin?
Probably a month ago.
Okay. And you said it was in your right leg?
Mm-hmm.
And how long have the symptoms been going on? How long do they last usually when it occurs?
It kind of occurs all day, but it's more of when I'm doing activities, it's more severe.
Okay.
And then when I rest, it goes down, but it never fully goes away.
All right. And what would you describe your symptoms as?
Just sharp pain,
Okay.
shooting upwards. It's like more on the inner, like my inner leg than outside.
Okay. And you said it was more on like your inner thigh,
Mm-hmm.
inner leg. All right. Anything that aggravates the pain?
Just walking and exercise.
Okay. And anything that helps it?
Resting. I usually ice it as well as heat it.
Okay. All right. Any other symptoms?
Mm-mm.
Okay. And what have you been doing to treat it so far?
I usually take ibuprofen
All right.
twice a day.
Twice a day. How many pills are you taking when you do that?
3.
Okay. And on a scale of 1 to 10, how severe are your symptoms? How severe is the pain?
When I'm resting, it's around a 4 or 5.
Okay.
And then with activity, it's 7 or 8.
And are you on any medications right now?
Just birth control.
Okay. And do you have any diseases or medical issues currently?
No.
Okay. And what about your past medical history? Have you been diagnosed with anything?
I've been diagnosed with partial scoliosis
Okay.
as well as asthma.
And has anybody else in your family been diagnosed with asthma?
My younger sister.
Okay. Right. And any past surgical history? Have you had any surgeries?
My wisdom teeth, my tonsils, and then my ear lobes or drums.
Okay. You had those all removed?
Mm-hmm.
Okay. And do you use any tobacco, cigars, cigarettes, chew?
Mm-hmm.
Okay. And do you drink at all?
Occasionally.
All right. And when you do drink, when is it usually?
Holidays.
Okay. All right. And do you have any drug use? Do you use drugs recreationally?
Mm-hmm.
All right. And so you said you were on birth control. What is the name of that?
Lutera.
Anything else at all? Vitamins?
Nope.
Okay. And for your family history, does anybody in your family have been diagnosed with any diseases, cancer, diabetes?
My grandma and my mom had diabetes.
Okay.
And then my mom and my grandpa have had like skin cancer, moles removed.
Okay.
My father has had Parkinson's.
Okay.
And then my uncle's had pancreatic cancer.
Got it. All right. Are you able to dress yourself?
Mm-hmm.
Do you use any assistive devices while walking?
Nope.
Okay. Any difficulty bathing?
Mm-mm.
Difficulty using the restroom? Any difficulty going up and down the stairs? How many days a week do you exercise?
I'd say 4.
And have you still been exercising that same amount with your leg pain?
Mm-mm.
Okay. How often are you exercising now with the pain?
Probably down to 2. But it's also been like a lighter exercise as well.
Right. All right. And for your diet, what did you eat yesterday?
I didn't have breakfast.
Okay.
I usually wake up pretty early.
Do you usually not have breakfast?
Mm-hmm.
Okay. And then lunch?
And then lunch I usually have like a chicken or tuna salad.
Okay.
With like crackers or chips on the side. And then I'll have a snack that's like a granola bar. And my dinner's usually some sort of meat with a veggie on the side.
Okay. How many steps do you have in your home? Staircases?
We have 2 staircases, so it's a 3-level home.
Do you feel safe at home?
Mm-hmm.
Who is your support person?
My sister.
Okay. Have you ever considered suicide?
Nope.
Are you considering suicide now?
Nope.
Have you ever attempted to harm yourself?
Nope.
Are you experiencing any symptoms that cannot be attributed to a physical disease?
Nope.
Do you find yourself losing interest in hobbies and things you normally enjoy? All right. Have you experienced any dizziness, blurred vision, or headaches?
Dizziness and headaches.
Okay. Any migraines or numbness?
Mm-mm.
Right. And does the dizziness and headaches, is that just whenever, or is it when your leg hurts?
It's just normal.
Okay.
For me.
Have you experienced any irregular heartbeats, chest pain, or redness or swelling?
Redness and swelling for the leg.
Right leg?
Mm-hmm.
All right. Have you noticed yourself being extremely pale, extremely tired?
Mm-mm.
All right. And then swelling in legs,
Mm-hmm.
right? Any high blood pressure, low blood pressure, or high cholesterol?
No.
Have you experienced any shortness of breath, coughing, difficulty breathing, or congestion?
No.
Any cramping, bloating, or gas?
Cramping and bloating.
Right. And is that just normal for you?
Mm-hmm.
Okay. Any constipation or decreased appetite?
Constipation.
And increased appetite, frequent vomiting, or frequent diarrhea?
Nope.
Any difficulty urinating, blood in your urine? Frequent urination or decreased urination, pain while urinating, or decreased stream. Okay. Do you have any wounds or non-healing wounds? Acne?
Mhm.
Unexplained bruising or rash or redness?
The rash.
All right, on your leg?
Mhm.
Okay. Any difficulty standing or back pain?
Mhm.
Any joint pain or stiffness?
Joint pain.
And that's also in your right leg?
Mhm.
Which joint would you say it's in? Knee, ankle, hip?
Knee and hip.
Okay. Any difficulty walking?
Yeah, when it gets severe enough.
Okay. Is that mainly just during activity?
Yeah.
Right. Do you have any changes in temperature tolerance or change in your energy levels? Abnormal growth or hormone supplements? Have you ever had thyroid cancer, hyperthyroidism, or hypothyroidism? Any pituitary disorders, diabetes, mellitus, or non-insulin dependent? All right. And can you tell me when your last period was?
2 weeks ago.
Okay. And have you ever been pregnant before?
Nope.
Have you had any births at all?
Nope.
Are you pregnant or could you be pregnant now?
Nope.